Hello ladies and gentlemen, welcome to my YouTube channel. Yet again another video in surgery and surgical nursing, and in today's video we're answering a question on tracheostomy. So the question is as follows. Your presenter here, IDE Henry. The question reads, Mutale, a 20-year-old girl is admitted to your ward with difficulties in breathing following a road traffic accident. She is scheduled for theater for insertion of tracheostomy tube, and the questions read, define tracheostomy, describe 5 other conditions in which tracheostomy can be performed, discuss the post-operative management of Mutale, and lastly, discuss 5 complications that may arise following tracheostomy. Without wasting much of your time, let's define tracheostomy. So you can define tracheostomy in the following way. Firstly, you apply your heading like so, you underline it, then you write the following explanations. This is a surgical procedure in which an incision is made in front of the neck to make an opening called a tracheostoma, and is done to facilitate breathing in cases of obstruction or inability of an individual to breathe through their nose or mouth. Next, describe 5 other conditions in which tracheostomy can be performed. Okay, so we have the following. Upper airway obstructions. What about it? When there is a blockage or severe narrowing of the upper airway due to reasons like tumors developing in the airway, inflammation, or trauma, a tracheostomy can be performed to clear and unobstruct airway passage. Secondly, ventilatory support. In cases of prolonged mechanical ventilation, such as patients with severe respiratory failure, a tracheostomy may be performed to provide a stable and secure connection to the ventilator. Next, neurological disorders. So these neurological disorders include amyotrophic lateral sclerosis or spinal cord injuries, which can lead to weakened or paralyzed respiratory muscles. So necessitating a tracheostomy can assist with breathing. And then the fourth one is severe infections. So severe respiratory infections or pneumonia, patients may require a tracheostomy to help with removal of excess mucus and as well as maintain airway patency. Then the fifth one, we've got trauma and emergency situations. So trauma to the neck, face, as well as life-threatening emergencies like severe burns or foreign body inhalation may necessitate an emergency tracheostomy to establish a stable airway quickly. Alright, we've answered question B. Question C says, describe the post-operative management of Mutale on tracheostomy. This is 50 marks. As usual, if you haven't yet watched my video on how to get 50 out of 50, please don't forget to watch it. I outlined the general layout of post-operative management. So the headings should flow as follows. ASEPOP TNHMI. Alright, that is AIMS, collection of patient from theater, environment, positioning, observations, pain management, tracheostomy care, nutrition, exercises, and elimination, hygiene, medication, as well as information, education, and communication, which is the IEC. Okay, what are our aims? The first aim is, I will ensure airway patency and adequate oxygenation. Secondly, I will prepare the patient for eventual decannulation, in short, tracheostomy removal when appropriate. And then, collection of patient from theater. So, there's handover from the theater nurse. I will get handover from the theater nurse on the name, an alive patient, the type of anesthesia used, post-operative plan, amounts of fluids infused, and if blood was transfused. I will also get handover on the latest vitals. You can also say, transfer of patient to theater. I will transfer the patient, to the ward. I will transfer the patient to the ward in semi-prone with head tilt to the side to allow drainage of secretions until fully awake from anesthesia. And then I will walk by the head side of the stretcher while monitoring the patient, and porter will walk by the foot end leading way to the ward. Having said that, you can now talk about your environment. So you mentioned the ward. So I will nurse my patient in surgical ward. Secondly, you talk of the area of admission. I will nurse the patient in acute bay for close monitoring and observations. You talk about equipment. So I will immobilize a post-operative tray, a drip stand, a working saturator or oxygen cylinder, a working suctioning machine, everything that is necessary around the patient's bed. Then you can talk about ventilation. I will open nearby windows to promote ventilation. I will ensure that the room is dusted and cleared of all microorganisms. And lastly, you can also talk about lighting. Now we go to positioning. You can say the following things. I will nest the patient in semi-fowlers or elevated head position to enhance breathing and minimize the risk of aspiration. You can also say, I will ensure that the tracheostomy tube is at the correct level and not pressing on tracheal wall. You can also say, I will utilize soft pillows to support the patient's head and neck to maintain proper alignment. Also, I will regularly reposition the patient to prevent pressure sores. Lastly, I will promote mobility when appropriate to avoid complications associated with immobility. Then we go to observations. I will continuously monitor the patient's vital signs including heart rate, blood pressure and oxygen saturation. I will assess the tracheostomy site for signs of infection, bleeding or skin breakdown. I will monitor for respiratory distress such as increased respiratory rate, use of accessory muscles, and so on. You can also say, I will observe for signs of distress and discomfort in the patient, and I will maintain a tracheostomy care chart to document observations and interventions. And lastly, that being the last point, you can now talk about pain management. So pain management, you can mention the following things. I will administer prescribed analgesics as needed to manage pain effectively. I will assess the patient's pain regularly and adjust pain management strategies accordingly. I will ensure that the patient is comfortable and pain-free while monitoring for side effects. You can also say, I will educate the patient on the importance of pain management and the use of pain assessment skills. Having talked about that, you can also say, I will promote non-pharmacological pain relief methods and relaxation, such as relaxation techniques and the like. Okay, we proceed. Tracheostomy care. This being our subsequent care, I will perform routine tracheostomy tube suctioning to clear secretions and maintain airway patency. Secondly, I will regularly assess the tracheostomy site for signs of infection, inflammation, or displacement. I will change the tracheostomy dressing as per recommendation, scheduled to prevent infection. I will ensure that the inner cannula, if present, is cleaned and well maintained following hospital protocol. And also, I will provide the patient and family education on tracheostomy care and empower them to participate in the care. Next, we have psychological care. Right. I will offer emotional support, reassurance, and active listening to the family to allay anxiety and distress. Keep it in mind that the patient does not talk because of the tracheostomy. And then you can say, I will encourage open communication with the patient and address any concerns or fear. I will provide resources for psychological counseling or support groups as needed. You can also say, I will create a calming environment by dimming lights and reducing noise to promote relaxation. Then lastly, I will educate the patient about the importance of mental well-being during the recovery process. That being our last point, we can now go to communication. Okay, so under communication, this is where we're going to mention quite a number of things because the patient is unable to talk. Communication is impaired. Alright, so we can proceed in the following manner. I will assess the patient's ability to communicate and determine the most suitable method such as writing, using communication boards or speech devices. Then you can say, I will ensure that the patient has easy access to communication tools and teach them how to use them with effectiveness. And then I will encourage the patient to express their needs, concerns and preferences, actively listening and responding with empathy. And then I will inform the patient and the family about the potential changes in voice or speech and provide strategies for effective communication. Keep it in mind that these points are very specific to the condition and you're going to get marks. Your marker will be impressed. Then lastly, I will involve speech therapists and communication specialists as necessary to support and enhance the patient's ability to communicate. Having talked about communication, next is nutrition or feeding. Because the patient has a tracheostomy may cause dysphagia, which is difficulties in swallowing. So I will maintain the patient new orally until bowel sounds return. That's the first one. I will feed the patient using a nasogastric tube, starting with liquid diet and on day one. That's on day one. And after bowel sounds return, you're going to day one after bowel sounds return. Then I will assess the patient's swallowing ability and determine the appropriate method of feeding. Subsequently, I will assist the patient in oral care and hydration while adhering to safety precautions. And lastly, I would document the patient's nutritional status or intake and collaborate with the healthcare team for adjustments. Next, ladies and gentlemen, is elimination. I will assist the patient with toileting and maintain a schedule for regular bathroom breaks. I will closely monitor urinary and bowel function to identify any issues promptly. I will maintain adequate fluid intake to prevent constipation and dehydration. I will follow a strict hand hygiene protocol during toileting assistance to prevent infection. Lastly, I will document elimination patterns and any concerns for healthcare team review. Then we can talk about exercises. I will assist the patient in mobility exercises to prevent weakness of muscles and complications as related to immobility. I will encourage the deep breathing exercises and chest physiotherapy to improve chest or lung functioning. I will encourage the patient to participate in appropriate activities to reduce boredom and enhance mental well-being. I will emphasize the importance of gradual activity increase and following medical advice. And lastly, we can talk about hygiene. I will maintain strict hand hygiene and wear protective equipment during all patient interactions. I will perform routine tracheostomy site cleaning and dressing changes as directed by the healthcare team. And also, I will help the patient with daily personal hygiene, including oral care and skin care. Then you can say, I will ensure a clean and clutter-free environment to prevent infection and promote comfort. Having said that, you can conclude with, I will educate the patient and family on hygiene practices to continue at home. Then we can talk about medication. I will administer prescribed medication accurately and adhere to the medication schedule. I will monitor the patient for any adverse reactions or side effects from the medication. Then you can say, I will document all medication administrations and including the dose, time, and route. I will collaborate with the healthcare team to adjust medication as needed based on the patient's condition. And lastly, I will educate the patient and the family on the purpose and potential side effects of medication. Lastly, we can talk about our IEC. So, I will provide comprehensive education to the patient and the family regarding tracheostomy care, safety, and potential complications. Alright? I will ensure that the patient and the family fully understand the purpose and care of the tracheostomy. Thirdly, I will facilitate open and honest communication between the patient's family and the healthcare team. And I will offer educational materials and resources for reference and support. You can also say, I will maintain a patient-centered approach, tailoring communication and education to individual needs and preferences. That being said, ladies and gentlemen, a quick summary. We have defined tracheostomy care in our video. We have described five conditions in which tracheostomy can be performed. We have discussed the postoperative management of Mutale. Then the last question is discuss 5 complications that may arise following tracheostomy. Number 1 is that of aphonia. The patient may have the inability to communicate because the tracheostomy impairs resonance during a speech of the airway. Then you can also talk about dysphagia. This is because the tracheostomy tube may also bulge when inflated and affect the swallowing ability because it presses against the esophagus. You can also talk about tracheostomy site infection being a complication. You can talk about tracheostomy site bleeding. And then lastly, you can talk about depression as a complication. That being said, thank you very much for watching my video. See you in my next video.